Samantha, I'd love to start with you. What was the problem you were trying to solve in Springfield?
Yes. So within my work as the director of coalition building, we work on projects around climate change, housing, and so forth. So one of the initiatives from our Kresge Foundation funding was a climate change, health, and equity initiative. And we work with community residents to kind of narrow down out of the climate action plan that the city has around 156 strategies on how to address climate issues down to two. So we did a whole iterative narrowing exercise and process and get community feedback. But once we landed on the two initiatives, and one being the one we want to highlight today around community choice aggregation or community choice energy, the next big question to us was one, how do you explain such a complex strategy to the broader community so that they can have buy-in and support? And how do we as a coalition unpack the same complex idea? So collectively, it was how do we learn together as a coalition? And how do we take what we've learned into the about the initiative or the idea into the broader community for them to support us, sign on to that petition? But community choice energy would allow equitable access to clean energy solutions for all residents. Where the problem that we recognize is that to get into this industry or to participate in clean energy solutions, you'd have to first be you first have to have like strong capital, like strong income, like to get solar panels, to get mini splits, to get anything around weatherization, depending if they have programs or not. There is a financial investment, and community choice energy was the opportunity where that investment was equitable for everyone to opt into. And that means switching over from your energy options from fossil fuels or coal to clean energy when it comes to lighting your home. So I'm solving the issue of electricity and lighting specifically with this strategy. So yeah, so the problem was multi-layered, that it was internal to figure out how to explain, external, and it tied into how could we then use what we've learned towards advocacy.
So you're in the public health side of the government in Massachusetts, and I'm curious, where did that start coalescing with climate policies?
Yeah, so as public health is in everything, and people sometimes think it's just if I work in public health, I might be a doctor, a nurse, or work in a hospital institution, but it is everything plus that. It is the CDC, it is EPA, it is all the departments that are working on the livability and wellness and health of people from a public health lens. So when we think about this work, environmental justice work is like I think the bridge that brings us all together, that in addressing the health outcomes of our community, we look at the environment. And if the environment is unhealthy or causing harm for our and wealth and health, then therefore there is a need for public health interventions. And that looks like, on one end, the asthma rates in our community. We were once the asthma capital of the US. Now we rank fourth. And it's due to just our climate, our environmental structure. We live in the valley. Pollen settles in the valley. We also have folks in the community that have chronic health issues, low income folks that need respite help. So a lot of asthma related issues, respiratory health issues. So folks are going to the ER a lot for these issues, and it's showing that there's a trend here. There's a pattern of poor health outcomes. So in that, we want to change the environment, reduce greenhouse gas emissions, reduce our carbon footprint, put in green infrastructure like trees and planting. That will then address that person with asthma, that person with respiratory issues, to have less need to go to the emergency room and have a better, healthier environment to live in. So when it comes to public health and environmental justice, the climate work that we do with this concept of climate change, health, and equity, it all has this like weaved relationship that they all intersect.
Okay, and so you're coming from this like large number of projects down to you came to two. And the ultimate goal, can you say that in one sentence of the problem you were trying to solve?
Yeah, the ultimate goal or the final goal was to have the city, because we are not the driver, we are the advocators, we are the agitators to drive the city to push forward this effort. Well, city council had to vote to approve community choice energy, and then the mayor's office and the city department had to then go into the process of applying for this and then implementing it. So our charge was to, here's a good idea, City of Springfield and our partners. Can we all get behind it and make it happen? So our charge was to influence and change behavior, or influence the system of the city government, so that they could push forward something we knew was going to have a big impact in our community.